While the healthcare industry remains complex and ever-changing, we are in a time of unprecedented movement. Rural Hospital board members are on the front lines of this transition, responsible for leading their organizations through the uncertainty and complexity associated with the shift to value-based payment. This program has been developed to provide board members with foundational knowledge and strategies for navigating this transition. Critical access hospitals and state flex programs continue to seek resources to support rural hospital board leadership development. A variety of resources already exist to support board governance training, but this series is different and will improve the understanding of board members' impactful leadership role. The series consists of 6 video modules. A suggested approach to use the content is that the board of directors watch one of the 6 15 to 20-minute videos every other month over the course of 12 months. Each module includes 3 parts: educational content from subject matter experts, including interviews with rural hospital board members and CEOs sharing best practices and words of wisdom, discussion questions for boards to consider how module topics apply to their organization and community, and suggested activities for boards to put best practices into action. There is also a guide that pulls together a collection of related resources to support learning. In the first module, we explore the transition to value in population health, highlighting the role of a rural hospital board. We look at ways to redefine the healthcare system in a community.
The American healthcare system is moving into an entirely different method of paying our healthcare providers and our hospitals. What was previously a payment for procedure to a new payment system that is largely based in value and is actually going to be built upon a system more focused on prevention and on wellness.
In the second module, we explore what it means to be a visionary leader and how a clear, compelling vision can positively impact your organization's journey to value.
Being the best these days means getting together with community stakeholders and making sure that you're not duplicating efforts. It means addressing issues in the community that are impacting somebody's overall health. It means recognizing if there are substance abuse issues or mental health issues and addressing those. So just as we make this move to value and population health, we really need to get a better understanding of what does best look like. And then that means having conversations with the community to find out what does best look like to them.
In the third module, we examine the importance of partnerships and collaborative decision-making.
So I think as we have shifted to value, I think that has broadened our view of who partners really are. It is more than just care delivery. Health is about access to recreational facilities. It's about access to healthy food. It's about access to a safe environment. So how we work within our community to make that the best is where we're starting to see us branch out. We are working very closely with our local government, but also with recreation. So we're working with them to do that in a collaborative way where we're focusing on health and wellness together, and it's not 2 separate entities doing 2 separate things.
In the fourth module, we look at the role that communication plays in all the things we've talked about so far in this program. We also share some strategies for communicating across audiences and creating compelling messages.
At the root of every problem we have, it's probably communication. So anytime that we can get people together to communicate face-to-face, I think we're more successful at being aligned together and engaged on projects that are important to our organization.
In the fifth module, we discuss the importance of identifying the skills and knowledge your workforce and senior leadership need to have in order to achieve your organization's vision.
The board should be very proactive in having a succession policy and a plan and educating the staff on that plan and revisiting a succession policy every year, making updates to it when it's necessary, so that if the time ever comes that they need to implement that succession plan, a well-executed plan will occur.
In our final module, we build on the ideas from previous videos to look at how the board directs others toward your vision by creating a culture of accountability and feedback.
It's making sure that you're talking about accountability, but not just paying lip service to it, but also making sure that you're measuring it. Because what you measure is what you actually work towards. So it's not a punitive culture, it's a here's where we are, how can we all get better, how can we do this together?
State Flex programs may incorporate sharing this video series to support trainings in the operational and financial improvement area of their Flex program, though the impact of this program will likely touch all aspects of the hospital.